One of the hot topics that I often hear people come to the office and ask me about are spine fusions. What is a spine fusion? Who needs a spine fusion? And what do you need to accomplish a spine fusion? A spine fusion, by definition, is taking away motion at a certain level of your spine, whether it be your neck, your mid-back, or your low back. What you're doing is really taking away motion. The question is, why would you do that surgery? The surgery is typically done for one of two reasons. And we're talking now in general terms. We're not talking about people with tumors, infections, or trauma. We're talking people that present with degenerative changes, arthritic changes. So you would do a fusion either to help somebody who had a stability issue in their spine, where their spine was unstable, and you needed to help stabilize their spine by taking away motion where there was too much motion, so to say. The other reason to do a fusion is if you're doing it to help decompress the nerves of the spine. One of the most common reasons that spine surgery is done, and probably the most common reason it's done, is to help take pressure off nerves that are giving people pain down their arms and their legs. Some of these procedures often include the need to do a fusion because of the amount of surgery that's required to take pressure off of those nerves. Now, the next question people ask is, well, how do you accomplish a fusion? Well, fusion has evolved over the years since I've been in training. Years and years ago, fusions were accomplished just by taking bone from other parts of your body and putting it into your spine to help prevent motion as it grew together. Now we have bone substitutes, and now we also use mechanical devices. We use screws and rods. There's devices to put between the vertebral bodies, and how these screws and rods get in and how these devices are put in has progressed vastly over the last few years. We've gone from doing big open procedures to now minimally invasive procedures. So the word spine fusion unto itself simply means taking away motion in any area of your spine. How that's accomplished is going to be dependent upon your disease process and your physician's artistic approach to spine surgery.